Nurse Aide Test Prep Book. Question 1. A client is in the active dying process. The nurse aide should: Option A. Avoid the client. Option B. Provide comfort measures. Option C. Stop all care. Option D. Leave the client alone. The correct answer is option B. Provide comfort measures. Comfort measures such as repositioning, mouth care, and emotional support are essential at the end of life. Avoiding or leaving the client alone is not appropriate. Stopping all care would be neglect. Question 2. When is alcohol-based hand rub acceptable instead of soap and water? Option A. When hands are visibly soiled. Option B. After using the restroom. Option C. Before touching a client with clean hands. Option D. After caring for a client with C. diff. The correct answer is option C. Before touching a client with clean hands. Alcohol-based hand rub is preferred when hands are not visibly soiled. Soap and water must be used when hands are visibly dirty, after using the restroom, and when caring for C. difficile. Alcohol does not kill spores. Question 3. The nurse aide is performing perineal care on a female client. The aide should: Option A. Wipe from front to back. Option B. Wipe from back to front. Option C. Wipe in circular motions. Option D. Wipe in any direction. The correct answer is option A. Wipe from front to back. For females, wipe front to back, vagina to rectum, to prevent introducing fecal bacteria into the urethra or vagina. Back to front increases infection risk. Question 4. What is the first sound heard through the stethoscope when taking blood pressure? Option A. Diastolic pressure. Option B. Systolic pressure. Option C. Pulse pressure. Option D. Pulse deficit. The correct answer is option B. Systolic pressure. The first Korokov sound heard is the systolic pressure. This is the pressure when the heart contracts. The diastolic is the last sound heard. Question 5. A client who is withdrawn and refuses to speak to anyone is likely experiencing: Option A. Depression. Option B. Anger. Option C. Excitement. Option D. Anxiety. The correct answer is option A. Depression. Withdrawal and refusal to communicate are common signs of depression in the elderly and chronically ill. While anxiety and anger may include withdrawal with silence more strongly suggests depression. Question 6. Which of the following can cause an inaccurate pulse oximetry reading? Option A. Nail polish. Option B. Client holding their breath. Option C. Client sleeping. Option D. Client sitting up. The correct answer is option A. Nail polish. Nail polish, artificial nails, and dark pigmentation can interfere with pulse oximetry light transmission, causing inaccurate readings. While breath holding and sleeping can affect readings, they don't cause device inaccuracy. Sitting up is a normal position that does not affect accuracy. Question 7. The nurse aide should report which finding as a possible sign of abuse? Option A. Bruises at different stages of healing. Option B. Bruises on the shins. Option C. A client who is hard of hearing. Option D. A client with memory loss. The correct answer is option A. Bruises at different stages of healing. Bruises at different stages of healing, varying colors, are a classic sign of abuse. Bruises on shins are common from minor bumps. Hearing loss and memory loss are health conditions, not necessarily signs of abuse. Question 8. Which is a violation of HIPAA? Option A. Discussing client care with the client's family who is present. Option B. Discussing client information in the elevator with another aide. Option C. Documenting care in the client's chart. Option D. Reporting client information to the nurse. The correct answer is option B. Discussing client information in the elevator with another aide. Discussing client information in public areas, elevators, cafeterias, hallways, violates HIPAA because conversations can be overheard. Discussing with family present, documenting, and reporting to the nurse are HIPAA compliant. Question 9. A client with mental health issues is refusing medication. The nurse aide should. Option A. Force the client to take the medication. Option B. Report the refusal to the nurse. Option C. Hide the medication in food. Option D. Tell the client they will get worse. The correct answer is option B. Report the refusal to the nurse. Medication refusal should be reported to the nurse. Forcing, A, or hiding medication, C, is unethical and illegal. Threatening, D, is not therapeutic. Question 10. A client who is agitated and wandering should be: Option A. Restrained to ensure safety. Option B. Redirected calmly to a safe area. Option C. Left alone to tire out. Option D. Given medication to calm down. The correct answer is option B. Redirected calmly to a safe area. Redirection is the safest and most respectful approach. Calmly guide the client to a safe area and engage them in an activity. Restraints require an order and are a last resort. CNAs cannot administer medication. Question 11. Normal oral temperature range is: Option A, 96.0 to 97.5 degrees Fahrenheit. Option B, 97.6 to 99.6 degrees Fahrenheit. Option C, 98.6 to 100.6 degrees Fahrenheit. Option D, 99.6 to 101.6 degrees Fahrenheit. The correct answer is option B, 97.6 to 99.6 degrees Fahrenheit. Normal oral temperature ranges from 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit, average 98.6 degrees Fahrenheit. 96.0 to 97.5 degrees Fahrenheit is below normal, hypothermia. 98.6 to 100.6 degrees Fahrenheit includes normal and low-grade fever. 99.6 to 101.6 degrees Fahrenheit indicates fever requiring reporting. Question 12. When documenting client care, the nurse aide should: Option A, use vague descriptions. Option B, be objective, accurate, and use only abbreviations that are approved. Option C, include opinions about the client. Option D, write in pencil so errors can be erased. The correct answer is option B, be objective, accurate, and use only abbreviations that are approved. Documentation should be objective, accurate, and use only approved abbreviations. Opinions are not appropriate. Pencil should not be used. Documentation should be in ink. Question 13. What does it mean when a client is placed on droplet precautions? Option A. The client must be in a negative pressure room. Option B. The nurse aide must wear an N95 respirator. Option C. The nurse aide must wear a surgical mask within 3 feet of the client. Option D. The client cannot leave the room. The correct answer is option C. The nurse aide must wear a surgical mask within 3 feet of the client. Droplet precautions are used for infections spread by respiratory droplets. These droplets travel up to 3 feet, so a mask is required within that distance. Negative pressure and N95 are for airborne precautions. Question 14. After giving a client a back rub, the nurse aide should always note: Option A. The last time the client had a back rub. Option B. Any change in the client's skin. Option C. The client's weight. Option D. The amount of lotion used. The correct answer is option B. Any change in the client's skin. The nurse aide should document any skin changes observed during a back rub, such as redness, dryness, or breakdown. This is part of routine skin assessment and helps prevent pressure ulcers. The amount of lotion used, last back rub, and weight are not the primary observations to document. Question 15. How should the nurse aide communicate with a client who has a hearing loss? Option A. Face the client when speaking. Option B. Repeat the statement. Option C. Shout so that the client can hear. Option D. Use a high-pitched voice. The correct answer is option A. Face the client when speaking. Facing the client when speaking allows them to read lips and see facial expressions, which aids communication. Shouting distorts sound, and high-pitched voices are often harder to hear for those with hearing loss. While repeating may be necessary, facing the client is the primary strategy. Question 16. A client is withdrawn and refuses to participate in activities. The nurse aide should: Option A, force the client to participate. Option B, allow the client to choose and respect their decision. Option C, leave the client alone. Option D, tell the client they must participate. The correct answer is option B. Allow the client to choose and respect their decision. Respecting the client's autonomy is essential. Forcing participation can increase withdrawal and anxiety. Leaving them alone may increase isolation. Offering options and allowing choice is the most therapeutic approach. Question 17. A client with a pulse of 112 beats per minute is experiencing: Option A, normal heart rate. Option B, bradycardia. Option C, tachycardia. Option D, arrhythmia. The correct answer is option C, tachycardia. A heart rate above 100 beats per minute in an adult is tachycardia. This is above the normal range of 60 to 100. Bradycardia is a rate below 60. Arrhythmia refers to irregular rhythm, not rate. Tachycardia may indicate fever, pain, dehydration, or other conditions requiring reporting. Question 18. Which precautions are used for clients with MRSA or VRE? Option A, airborne precautions. Option B, droplet precautions. Option C, contact precautions. Option D, standard precautions only. The correct answer is option C, contact precautions. MRSA and VRE are spread by direct or indirect contact. Contact precautions require a gown and gloves for all client interactions. Airborne precautions are for TB and measles. Droplet precautions are for influenza and meningitis. Question 19. When applying a gait belt, the nurse aide should place it: Option A, around the client's chest. Option B, around the client's waist, over clothing. Option C, around the client's hips, under clothing. Option D, around the client's neck. The correct answer is option B, around the client's waist, over clothing. A gait belt should be snugly around the client's waist, over clothing, not bare skin. Not over the chest, restricts breathing, not under clothing, skin irritation, and never around the neck. Question 20. When removing PPE, which item should be removed first? Option A, gloves. Option B, gown. Option C, mask. Option D, goggles. The correct answer is option A, gloves. Gloves are the most contaminated item and should be removed first to avoid contaminating other items. The correct sequence is gloves, goggles/face shield, gown, mask. Question 21. A client with dementia is eating slowly and forgets to chew. The nurse aide should: Option A, feed the client quickly. Option B, provide verbal cues to chew and swallow. Option C, puree all food. Option D, remove the food after 15 minutes. The correct answer is option B, provide verbal cues to chew and swallow. Verbal cues, example, chew your food, help the client eat safely. Rushing increases choking risk. Pureeing may be necessary for some but not all. Removing food after a short time may result in inadequate nutrition. Question 22. When making an occupied bed, the nurse aide should: Option A, roll the client side to side, working with one side at a time. Option B, have the client sit in a chair. Option C, make the bed with the client on one side only. Option D, ask the nurse to help. The correct answer is option A, roll the client side to side, working with one side at a time. Making an occupied bed involves rolling the client to one side while changing linens on the opposite side, then rolling to the other side. Having the client sit in a chair is for an unoccupied bed change. Question 23. What should the nurse aide do first for a client who has fallen? Option A, move the client to their bed. Option B, assess for injury and call for help. Option C, document the fall. Option D, call the client's family. The correct answer is option B, assess for injury and call for help. Assess for injury while calling for help. Moving without assessing could worsen injuries. Documentation and family notification are secondary. Question 24. The pulse site most commonly used for adults is the option A, brachial artery, option B, radial artery, option C, carotid artery, option D, femoral artery. The correct answer is option B, radial artery. The radial artery at the wrist is the most commonly used pulse site because it is easily accessible and does not disturb the patient significantly. The brachial is used for blood pressure in infants. The carotid is used in emergencies. The femoral is rarely used for routine assessments. Question 25. What is the correct procedure for taking an oral temperature? Option A, place thermometer under the tongue, close mouth. Option B, place thermometer under the tongue, breathe through mouth. Option C, place thermometer between the teeth. Option D, place thermometer on the tongue. The correct answer is option A, place thermometer under the tongue, close mouth. The thermometer must be placed in the sublingual pocket with the mouth closed. Breathing through the mouth or placing on the tongue leads to inaccurate readings. Placement between teeth risks breaking the thermometer.